You heard from Athena, and in a few moments, we'll be hearing from Dr. Warning, who's the medical director of outpatient behavioral health here at the Columbia Medical Center. I want to thank all of them. So let's get back to what we're talking about here. I talked about New Yorkers who are suffering, wrestling with isolation, addiction, self-harm, depression. And we know it only gets worse if you don't treat it. So here's what we're going to do. I'm making sweeping investments. What we want to do is help people when they need it most. Last year, we talked about a $1 billion investment. $1 billion, first time ever, more than any state in the nation is committed to solving this problem. I knew we wouldn't solve it in 1 year. That's impossible. But we're starting to. We've increased mental health care funding by 33% in just 2 years. That's how you make up for lost time. We have targeted hundreds of millions of dollars toward outpatient community-based services. We've created over 3,500 housing units. Imagine that. 3,500 people at one time can now get the help they need in a controlled setting with professionals and make sure they don't leave until they're on a path to recovery. That's the difference we're making. We're also going to be increasing our inpatient capacity as well by 1,000 more beds and helping our kids, helping them with eating disorders and more school-based mental health clinics, because parents can't take time off their jobs and take the kids to an appointment that might be 11 o'clock in the morning. That doesn't work. You do it in school where the kids are. That's where they're showing up every day. We do it in our schools. Because guess what? These kids, and it's not just the teenagers, but they're considering suicide at rates that were never even talked about before, twice as high as a decade ago. What happened? I think historians will look back and maybe perhaps because of the pandemic, the advent of social media emerging at the same time, this is almost a lost decade when kids are twice as likely now, twice as many more children are likely to want to commit suicide. I do believe social media has been a huge factor. That's why support stands side by side with our Attorney General Tish James, and we're demanding more accountability from social media companies. It's not just for one-day press conference. We are going to be relentless in pursuing this and advancing legislation to protect children's privacy and regulate the toxic, addictive algorithms that, if you don't understand how this works, it is deeply sinister. How there are people trying to figure out how to keep your child's attention even longer and take them to dark places. They may look up something that says suicide because they're trying to figure out how not to commit suicide, and there's algorithms that tell them how to do it. That is detestable. And I'm sick and tired of those influences. The influence should be the parents, the teachers, the neighbors, the clergy, the religious foundation, peers, not these dark forces that are lurking out there trying to capture your child's mind. And that's how serious this is. And I mentioned COVID. As adults, we're thinking, well, that was so 2020, 2021, we've moved on, right? You know who does not have the developed coping skills that adults have? The kids. I've sat with kids in Brooklyn, in Manhattan, the Bronx, listened to them, let them be honest with me, and they're still talking about it as if it's still going on or it was just yesterday. They've not escaped the clutches of this time in their lives when they are supposed to be kids or at a high school meeting friends or having that prom and going to some games and graduating. They lost all that. It was robbed from them. And we as adults say, yeah, you didn't get some prom pictures, it's okay. That's not what happened to these kids. They spiraled. And they don't just come back because someone declared the pandemic over. That didn't happen. We know that now. Since the pandemic, we've seen an uptick of over 70%, a 70% uptick in kids going to school-based mental health clinics. Now, that's a shocking statistic, except when you realize a lot of schools don't have mental health clinics. So these are the ones where it's available. What about those kids that don't even have that, waiting for them? What happens to them? That's why my commitment goes deep. I'm committing to provide mental health services to every school-age child who needs it. And every school that wants a mental health clinic will get one. And there's a program called the Youth Act. It's a great program. It's the first in the nation. It allows kids to stay in their schools and communities when they do need serious help, investing in them, helping them grow healthier, happier. But we talk about the kids, a lot of adults. A lot of adults are struggling. And some of them have their own kids. And their own kids see them spiraling, and the kids don't get that foundation of love and adults who act like adults because they need their own help. That's another tragedy. It's the trauma that can go on for a generation. And how does that stop? Too many adults grew up in environments of neglect without the help they need. We have people like Athena who broke out of it. That's a powerful story. And she's there helping those who've not been able to break out of it. She's there to help them now. And they can pose a danger to themselves. We have to recognize that. And that's why we have to change our behavioral health system overall. Under our proposals, hospitals will be required to screen people for mental health conditions before they're discharged and require follow-up psychiatric care and coordinate it before they leave. Don't just say, we took care of you for 24, 48 hours, we're done, you look okay, good luck. That doesn't work. That's just inviting them back again, except next time there might not be a bed available, and they'll just be out there on the streets. We need to expand also mental health courts, because so many people circle in and out of the criminal justice system. Empower court-based mental health specialists who see in real time with their training, their knowledge, they know what's going on. Can't expect our court personnel and our judges to know all this. And I also want to create 200 best-in-class inpatient beds, be a model for others, and transition more people to homes, specialized permanent housing. Now, one would say, well, I have insurance. Isn't that supposed to cover everything? Guess what? They have not been doing this. Insurance companies, and many are doing the right thing, and there are others who are not. They're finding every way they can to evade covering you. You pay in all these years, your employer pays in, somebody's paying in, and now when you want to draw down and get help you need, well, we don't have a provider that's in network. Oh, these are our providers, but you call through the list of 10 and they actually don't really exist anymore. And you just, at some point you say, I've got to get back to my job. I can't spend my day trying to find a provider. That's the reality of people. That's life. No New Yorker should be deprived of care because insurance companies won't cover it. I'm going to make sure they pay. Make sure their list of providers is up to date and accurate. Those are real people, not just names and an address and a phone number that don't exist. I'm also going to keep confronting that opioid crisis, the epidemic that it is, with the urgency it demands. As I said, we've led our nation in dispersing over $190 million already, and there's more to come. But I need to bolster our workforce as well. I need more people in this field. That's a challenge as well. Now, the good news is we're talking about it. We're focusing on it. People are saying, yeah, I guess I do need help, and now the insurance company will pay for it. But what if there's no one out there because our workforce has been depleted? We lost a lot of people during the pandemic, good, hardworking people, dedicated themselves to helping others. Some lost their lives because they were on the front line. Others just said, I can't do this anymore. I'm exposing my family. We know what happened to the healthcare workforce overall. We've been talking about that. But we have to expand our workforce of addiction treatment professionals and expand our outreach street efforts. Go where the people are. Distribute the naloxone and the fentanyl and xylazine test strips. We know they save lives. So we have a lot of ambition. Tackling this crisis is at the top of my priorities, which is why this is the first place I've come since we unveiled our State of the State. And I want to make sure it's happening. So starting today, I want to announce something already. I want more community-based hospitals to open more inpatient beds. And what I'm doing today is announcing $50 million is now available to community-based hospitals who are working to increase their psychiatric capacity. $50 million is going out. Now, what can this be used for? Literally, they can buy new property, expand facilities, cover construction costs. Because we can say we want more beds, if you don't make the buildings bigger or add more capacity, it's not going to happen. So we're really taking this down to the nuts and bolts. Money is needed to build more. It's real simple. Common sense measure that'll help us deliver real results. Well, let me close with this. I'm so proud to work with the New York City's Children's Center and the Bronx Psychiatric Center campus. This is a state-run facility. These are state workers. When I think about my state workforce, I'm proud of every one of them. But I want all of the people who work here to stand up, take a bow, and let us thank you for what you do every single day, saving lives, giving people hope. And Dr. Sullivan and all your team, they have over 550 people, dedicated, hardworking. They treat several thousand youth and their families every single year. This is a place where futures change. You give them hope, you give them love, you give them compassion. And as your governor, I could not be prouder of what you do and that you've dedicated your life to serving others. That's what we're called on this earth to do. We all have to give in some way. We all have to make this place better, and all of you are doing it in a very direct, profound way, so I say thank you. All of us agree that no New Yorker should feel abandoned, tossed aside, that there's not a pathway to recovery, and every child has to be given the tools to succeed. They have to, because that's what we're going to continue to do to make this the greatest state in the nation, because we're investing in our people, and it starts in places like this. So, ladies and gentlemen, thank you very much for participating today. Thank you for being here. And with that, let me bring up Dr. Warning to talk to you more about the work that he is doing to help our people recover. Dr. Ing.
Good morning, everyone, and let's have another round of applause for our incredible governor. So I'm grateful for the invitation to share, really lifting up the voices of the people living with mental illness that we serve every day. And especially coming on the heels of this incredible announcement this morning, but also with the governor's State of the State address, inspiring our entire state, but also acknowledging the challenges that we face. I think that the State of the State, you shared your admiration for the 26th president, Teddy Roosevelt. And Teddy Roosevelt said that if you believe you can, you are halfway there. And thank you, Governor, for believing in the greatness of New York today, but also its bright future tomorrow. And thank you for believing in the power of the people of New York when we address their behavioral health issues and their well-being head-on. I think one of the things that I'm really grateful for is I'm lucky to be a child and adolescent psychiatrist and adult psychiatrist because I have the privilege of actually treating people throughout their lifespan. And that's exactly what you've done, Governor. You've definitely looked at the entire plan and you're meeting New Yorkers where they are in their life journey. Not only meeting them where they're at in their journey, but meeting them where they're at. So providing services through telehealth, through their schools, through their clinics, through their homes, but also through their places of worship. Teddy Roosevelt also said, do what you can with what you have where you are. And that's exactly what you're doing. A year ago, I was so honored and privileged to contribute to your first inaugural Youth Mental Health Summit. And you have not stopped transforming the care for our young people of this great state since that time, and they desperately need it, as you've shared. One of the things that I'm very mindful of, and thank you so much for Athena for really opening this morning with the power of the youth advocate force. When 1 in 5 New Yorkers experience a mental health or behavioral health condition, and 50% of them start having those symptoms before the age of 14, we have to start earlier to get them the help they need so that they can fulfill their potential. And in the words of Teddy Roosevelt, believing that they can. Through the expansion of the school-based mental health programs, home-based crisis intervention programs, suicide prevention for youth of color, as well as the innovative Youth Act teams, you are sending a clear message to our young New Yorkers that you believe they can. And I think one of the things, the incredible, unprecedented investments in behavioral health in New York State have really celebrated the lifespan. So you're really looking at mothers and children with Healthy Steps programs, as well as meeting the needs of our seniors through critical time intervention programs. You're also acknowledging that the house is not a home if you don't have housing. So housing is a part of treatment. And also acknowledging the importance of our precious mental health pipeline. So really ensuring that we're more diverse, but also more equitable in terms of our loan repayment programs. I wanted to thank you, Governor, for your transformative leadership, but also believing in the power and also the promise of the people of New York, starting with the very young, but not stopping there, and celebrating their entire life so that they can fulfill their potential of contributing to this great state of New York. Thank you so much.
That concludes our program. Please remain seated while we take some photos.
I got a love so deep in the pit of my heart, and each day it grows more and more. I'm not ashamed to come and plead to you, baby. Your pleading keeps you from